Molluscum contagiosum is caused by a pox virus known as the Molluscum contagiosum virus, or MCV. It mainly affects children, usually between the ages of 1 and 10, although it also can affect immunocompromised patients, such as patients with HIV. Areas it affects include the armpits, knees and groin. Transmission of Molluscum contagiosum is through close contact between individuals and also contaminated objects such as towels. The lesions of Molluscum contagiosum are multiple, dome-shaped, waxy, skin-coloured papules 2 to 4 millimeters in diameter with an umbilicated centre, and after a few months the Molluscum contagiosum lesions spontaneously disappear. Histologically, Molluscum contagiosum is composed of multiple lobules of epidermal cells protruding into the dermis, and they contain inclusion bodies in the cytoplasm a few layers above the basal layer, and the inclusion bodies are called molluscum or Henderson-Patterson bodies. And these molluscum bodies increase in size as they ascend through the epidermis, compressing the nuclei into crescents. Another feature is that the molluscum bodies are eosinophilic at the basal aspect of the epidermis, and as they ascend through the epidermis, they become hematoxyphilic or purple staining. Here is a low power view of Molluscum contagiosum. You can see the lobules pushing into the dermis, and as we move to the top of the picture you can see that the lesion is umbilicated with a central crater. Here is another low power view of Molluscum contagiosum. Here you can see the molluscum bodies that arise a few cell layers above the basal layer, and they gradually increase in size as they ascend through the epidermis into the keratin layer. At higher power you can see that the molluscum bodies are eosinophilic or pink staining at the basal aspect of the epidermis, and as they ascend through the epidermis they become basophilic or hematoxyphilic or purple staining.